Hey guys, welcome back to my channel. So I'm bringing you another great opportunity to work from home, of course, and the name of this company is Conifer Health Solutions. That's the name of the company, and they have a great opportunity for those who are seeking to work from home. This is an area where you can put in the keyword search bar. You can search for open positions. So if you're looking for something else other than the position that I'm going to be talking to you about, which is the patient account representative remote position, feel free to do so. The key search here, facility, which is the locations. If I click here, I'll click on it for you. Conifer Health Solutions. So they have different facilities and then categories. If you're looking for something else, you can just click here and go ahead and click search. But right now, we're actually looking at the patient account representative position, which is remote. All right. And they posted this on the 7th of September. So that was a few days ago. And so, yeah, let's get right into it. Let's talk about this job, guys, so we can get you working from home if that's what you're looking to do. So, the patient account representative, you're going to be responsible for working accounts to ensure they are resolved in a timely manner. So, if you're familiar with patient account representatives, you know that they work accounts for those patients that come into the clinics, our facilities, hospitals, things of that sort, and they work their cases. All right, so let's go ahead and talk just a little bit more about your duties and what you're going to be doing in that area as a patient account representative. So, the candidate should have a solid understanding of the revenue cycle as it relates to the entire life of a patient account from creation to payment. All right, so the representative will need to effectively follow up on claims submissions, remittance review for insurance collections, create and pursue disputed balances from both government and non government entities. All right, so you need basic knowledge of commercial managed care, Medicare, and Medicaid insurance is preferable on this job. So I kind of wanted to go over that job summary because some people don't always read that part and they just apply and then say, oh, you know. So just kind of wanted to put that out there so you'll know what you're getting into when you apply for this job. So the representative here must be able to work independently. You need to be able to work on your own after you go through training. You need to be able to understand the training concept and the protocol in which they want you to follow when you're handling patient accounts. All right, so you're going to be performing your duties as assigned in a professional demeanor, of course, which includes interacting with insurance plans, patients, physicians, attorneys, and team members as needed. So you want to follow that confidential rule that they have that you're probably going to be completing and signing, like the HIPAA Act, so that you can keep the patient's information confidential. You cannot share this information outside of this job because this is still dealing with health. Okay, guys? So I just wanted to put that disclaimer out there because a lot of people don't understand how serious healthcare business is when you're working for the company. So you do need basic computer skills to navigate through the various systems, applications provided, okay? You need access payer websites and discern pertinent data to resolve accounts skills. So you need to be able to access the payer websites and you need to be able to discern pertinent data to resolve accounts. All right, so you need to understand the concept. You need to be able to utilize all available job aids provided for appropriateness in patient accounting processes. So, if you never worked from home and you needed the job aids is really just like that knowledge based information that they provide you during training. So, you definitely want to download all of the job aids that they give you and the processes in the order in which they need you to follow it. Because that's going to be very helpful in this job. I just kind of want to stick that out there to someone. You need to be able to document clear and concise notes in the patient accounting system regarding claim statuses and be able to take any actions on that account. You need to be able to maintain department daily productivity goals and completing a set number of accounts while also meeting quality standards. So they have a goal quota to meet. You need to be able to go through a certain amount of accounts. So you definitely want to pay attention in training. You need to be able to identify and communicate any issues, including system access, payer behavior, account workflow inconsistencies, or any other insurance collection opportunities. Provide support for team members that may be absent or backlogged. Okay, so that's really it. It's not too bad. And so your essential duties and responsibilities will include the following. Others may be assigned, but I'm quite sure you'll have the training on that as well. So, researching each account using company patient accounting applications and internet resources that are made available. You're going to be conducting appropriate account activity on uncollected account balances with contacting third party payers. You're going to be also patients via phone, email, or online. So, in this way, you're going to be sending emails, you're going to be contacting them on the phone, and accessing their information online to reach out to them as well. You're going to have that problem solving skills, guys. You need to be able to problem solve issues and create resolutions. So you need to be able to reach out to your team lead, or if you are the team lead, you need to be able to reach out and escalate that information to the higher up, okay? And be able to bring in revenue, eliminating rework. All right, and updating plans, IDs, adjust patients or payer demographic insurance information, notate accounts and details. So really you're going to go into these accounts where you see error, you're going to follow with that. If they trained you in a way where you can, correct that error, then you'll be correcting the error yourself based on the protocol and training that they taught you. But if it's something that you don't understand, I'm just kind of giving you these tips because I work patient accounts, but I was dealing with like providers and things like that, and it was a little bit more different, but it was dealing in the claims department. So with claims, you really have to be careful and really pay attention to what you're doing and really understand the questions that's being asked when you receive phone calls from patients. Okay, guys? All right, and then so you're going to be performing special projects and other duties as needed, recognizing potential delays and trends with payers, such as corrective actions and response to avoid AR aging. So you don't want that case to age too long. You're going to be escalating payment delays, problem aged account timelines to supervisors. So if an account has been in the system too long and it should have been worked a while ago, you want to report that to your supervisor. Participate and attend meetings, training, seminars, all of that good stuff. Respond timely to emails and telephone messages. So this is just kind of the rundown of what you're going to be doing and how you're going to be dealing on this job. And if you know about patient accounts and dealing in the healthcare field, you kind of get the gist of this thing, okay? And then you're going to be responding timely to emails and telephone messages as appropriate. All right. So the knowledge and skills and abilities, let's kind of get to that to see if this is something that you may have built over the years in your career, right? So in order to perform this job successfully as an individual, you must be able to perform each duty to their satisfactory, okay? So the requirements are listed below. You need intermediate skill in Microsoft Office. So you need to be able to use Word and Excel, basically. Ability to learn hospital systems, ACE, VI, Web, IMAX on demand quickly and fluently. So if you've been able to use like system softwares before and you work from home, you know how to use systems and you kind of understand the concept of using systems, logging in, logging out, support tickets, just hospital information, things like that, and just their CRMs, then you should do really well in this job. You need to be thorough understanding of the revenue cycle process, from patient access, things of that sort, authorizations, admissions, patient financial services, billing, insurance appealings. So basically, you just really need to understand the terminology of these terms that they're putting out there, like authorizations. Like a lot of times they call in about pre-authorizations. Things have to be authorized and pre-authorized, referrals, things of that sort. So that's what all of that is. And you'll learn that in training. If you worked in the medical field, that'll be a plus for you. The ability to communicate in a clear and professional manner, must have good oral and written skills. And so the reason why this is very important, because when you're dealing with healthcare, you definitely need to be able to understand the revenue cycle process. You need to understand those terminologies like what is an authorization, patient access, patient financial services. You need to understand those things. Insurance appeals. That's just basically they're appealing the insurance. Maybe they weren't paid out or enough, or maybe they approved a certain amount and there may be an appeal, an insurance appeal based on that. So you just need to understand things like that, just to kind of help you out there. Strong interpersonal skills, above average analytical and critical thinking skills. You definitely do need above average. So that means you need to be a thinker, needs to be someone that understands concepts, terminologies. You need to be able to break things down and really be a great problem solver, because you really do have to be careful with these accounts. All right, because you don't want to cost the hospital and you don't want to cause delays in patients' accounts and things like that, people being paid and all those things. Ability to make sound decisions, familiar with terms such as HMO, PPO, IPA, and capitation, and how these payers process claims. That is so important. Intermediate understanding of EOB, and intermediate understanding of hospital billing from requirements. Like I mentioned before, you need to understand these forms, what these forms represent, things like that. If there's errors on these forms, then they'll be sent up to escalations and for reconsideration, things of that sort. Ability to problem solve, prioritize duties, and follow through completely with assigned tasks. So it sounds like a lot, but it's really not that much. Once you go through training, it'll just make more sense unless you're someone that already worked in areas like this and you dealt with claims and processing and things like that. You kind of get what I'm talking about. But if you're someone that really wants to get into this, then yeah, get into the training. If you have a little bit of medical background, maybe you work in a hospital, things like that, that'll be a plus on your application to pull you into this door so that you can get into this job field and really learn this concept and learn processing and claims and things like that. So education wise, high school diploma or equivalent GED, some college coursework, 1 to 4 years medical claims. Like I said, dealing in the medical claims, hospital collections experience. That's a plus. And the minimum typing requirement is 45 words per minute, which I get why it would be, because you're going to be using those fingers. You're going to be tapping on those keyboards to get this information and things like that. And so you might want to do a typing test so you can just kind of brush up on your skills if you're already good in typing. And then they have physical demands. Described here are representatives of those that must be met by an employee successfully to perform their job. So, office and teamwork environment, ability to sit and work at a computer terminal or extended periods of time. So, if you're okay with sitting down and just really focusing and getting the work done, then there you go, and there you have it. That's what work from home jobs are. You work from home, you sit at a desk, it's like administrative work. And if you're someone interested in that field, then this is a great position for you. So, again, so your compensation is $15.80 to 23.70 per hour, and that's if you've already been in this field. So I recommend you kind of negotiate that pay, and maybe you want the top 23.70. Someone like me would be getting the 23.70 because I've been in this field for over 15 plus years, so I kind of know what I'm doing there, right? I know a little bit something about something when it comes to working from home and just dealing in administrative work. All right, so there you go, and there you have it, guys. And they do have benefits: medical, dental, vision, disability, life insurance, paid time off, 401k, 10 paid holidays, health and savings account. They have the hookup for you, so that's a plus there. And yeah, that's it, guys. There you go, and there you have it. And so here you can sign up for job alerts if you're interested in things like that. You can do something like that if you want to. But yeah, I just recommend if that's something that you're interested in, you should sign up for it and just go ahead and apply for this job. It seems like a good job if you're interested in patient accounts. So that's it. You click here to apply now for this application, and you go through, make sure you read that thoroughly, complete it accordingly, and that's it. Well, that's my time, guys. Like, share, and subscribe, and ciao.